Hi, this is Dr. Janson, and I am a conservative biomechanical podiatrist, and my practice is really based on orthotics and prosthetics and braces. I used to be trained I was trained as a surgeon and used to do a lot of foot surgery, but little by little, because no podiatrists are making orthotics by hand anymore, I became basically the last one, I think, in Manhattan to do it. I got more and more away from surgery. But of course, surgery sometimes is the necessary treatment for certain problems. So what I did was I created a referral base of different foot surgeons based on the techniques that they did, which was appropriate for that type of problem that the patient had. Now, one type of foot surgery is called M.I.S. surgery, and that stands for Minimally Invasive Surgery. It means the incision is very small, so that when the surgeon is operating on the foot, they actually will use a C-arm X-ray where the surgeon can look at a view screen and see the instruments inside the foot while they're working, which is technically very difficult because you can't really see what you're doing with your hands. You're looking almost like in a mirror image in a way of what's going on. So it takes hundreds of hours to train for that. The surgeon is not working, so they have to, lose the business from the practice. They have to pay for the training. So very, very few foot surgeons actually do true M.I.S. surgery where there's basically no hardware and there's no incision at all, really. Very few. So one of the best surgeons that I have ever seen doing this is Dr. Helene Nguyen does this. She's in Hackettstown, New Jersey. It's not close to my Manhattan office at all. So patients do have to travel over here. I think with public transportation, it's about a 2-hour trip to get here. But because I have not found any surgeon doing, truly minimally invasive surgery in Manhattan, that when it comes to a case that really needs that kind of a treatment, then I do send the patient out here to Hackettstown. So the reason why I'm making the video is so I can have the patient look at this video and you can see what the office is like and meet Dr. Nguyen, Dr. Helene Nguyen, and then you could see what it would be like to travel here and then have a very appropriate type of surgery done and get very, very good results from her work.
Hi, welcome to Feeding Beyond. I'm Dr. Helene Nguyen. I want to give you a tour of our office in Hackettstown, New Jersey. I'm a podiatrist. I specialize in minimal invasive surgery. So if you come to the office, let's follow through with me. Here's our reception area.
Hi, my name is Hillary. I'm the office manager for Dr. Nguyen's at Feet and Beyond. You'll be seeing me when you travel all the way from Manhattan to here. I'll be one of the first face for you to meet. So just want to say hello and welcome to our office.
Now let's follow me to the waiting area for the patients. And here come our exam room. One thing about our office, we specialize in minimal invasive surgery. So most of the time when the patients come to see me for a surgical consultation, I will examine them in the office in the exam room, and then we're going to follow with the x-ray examinations. And on the day of the procedure, we do have in-office procedures suite that we do. So it's going to accommodate the patients to do procedure and be able to leave on the same day. All right, so let's follow me to the surgical suite. So here's our surgical suite. So we use minimal invasive surgery, and then we're not using any sedations. Every patient that we do to non-sedated, local anesthetic, patient be able to stay awake and see us throughout the whole healing process, and they also be able to walk throughout the healing process. One good thing about minimal invasive approach that I'm using is that I don't use any hardware, and that's a key factor. It's a benefit for the patients for any corrections of bunions, hematomes, heel spur, even neuroma. We have all that technologies that be able to accommodate the patient healing and be able to get them back to their feet as quick as they can.